Harm reduction is underfunded for a long time. What are the trends in recent years? Are there any developments anywhere in the world?
There's a lot of developments. We've been talking about harm reduction funding as being in crisis for a long time. The latest report that we produced was looking at the year 2022, and we found 151 million for harm reduction in low and middle income countries from domestic funding and from international donors. And this report includes various kind of concerns that we highlighted, because we already know that's a 94% funding gap overall, which UNAIDS has told us that we need 2.7 billion each year for harm reduction, and 151 million is nowhere near this amount. So this is a huge problem. The trends that we've seen in recent years, I think it's important to note that international donors are still a really important part of the harm reduction funding environment, and between 2019 and 2022, we saw an increased reliance on international donors, and in particular the Global Fund. So in 2022, we saw that the Global Fund was 3/4 of all the international donor funding. And in 2007, when we first started doing this piece of research, they only accounted for 30%. So it's been a big shift over time, that the Global Fund is where governments are putting their money and saying that's how they're funding harm reduction. They're not funding bilaterally so much anymore. This year, this report, we only had 3 governments funding bilaterally: the US, the French, and the Netherlands. And for 2 of them, that was under 5% of the international donor funding, and the US was 8%. So really, much smaller amounts than we would like to see from governments that do care about harm reduction on paper. So then we kind of talked about all of the concerns that we had within this report in 2022, and one of the things that we highlighted was this kind of precariousness of harm reduction funding, because there's so few international donors, and so it means that if one decides to change their mind about funding harm reduction or funding in general, then we see a lot of problems, and so really, the words to describe what's happening now are, it's worse than a crisis. It's a catastrophe for harm reduction funding at this point. In January, when we saw the news about the US dismantling USAID, we kind of saw the executive orders coming out, and the impacts for harm reduction they're still unfolding. We're still kind of learning about what these impacts are, and I think over time they'll change. So I think we'll make an effort to really look where the dust settles in a few months' time. But at this point, we know that PEPFAR was the second largest donor for harm reduction, and has been since we started doing this research. It's not a huge amount in the grand scheme of things for PEPFAR, but it's really important for harm reduction. And they were funding things like opioid agonist therapy for people, and the data that we have looked like they were funding that for about 30,000 people across 9 countries by 2024. And they also fund needle and syringe programs, although they don't fund the procurement of needles and syringes. Other donors support that part of the funding, but they funded the infrastructure and the clinics and the drop-in centres. So these are hugely important programs for harm reduction. Another really key area that they provided a lot of funding for was the peer outreach piece. So that's obviously a really important part of harm reduction. So the impacts that we've seen are that OAT, opioid agonist therapy treatment, has been disrupted in many places. And when that treatment is disrupted, that's a risk to life. People will then decide that they might have to go and use heroin again, and they might end up using riskily, and there's a risk of overdose. And we're hearing overdoses being reported. So this is really, really serious. With needle and syringe programs also, they've been disrupted because of the piece of the PEPFAR funding within those programs. In many countries, those have just disappeared, they've closed. But most importantly, I think to emphasise is the peer outreach piece, because this is the essence of harm reduction. The peer workers going to meet people and bringing harm reduction to the community and meeting people where they're at. And if you don't have that piece, you don't really have harm reduction in a functional way, where in some countries people are being told to go to public hospitals to receive their OAT, which they may not even be able to receive. And when they get there, they might be stigmatized. They risk, sharing that they're people who use drugs in a place where that might not be welcome. And so this is really not realistic as an option for many people. And then beyond the service provision piece, the USAID money, PEPFAR money, was funding really important other aspects that have an impact on harm reduction when they stop. So the multilateral piece, we really rely on UNAIDS being a voice on harm reduction and emphasising its importance. And the stop work order there was a problem, and now the funding cuts are a problem. And other UN agencies, WHO, UNODC, are important for harm reduction. So this is serious, and also the Robert Carr Fund as a really crucial funder for community networks and civil society networks. Without the Robert Carr, many organisations are facing closure, and without those advocates working at the national, the regional, the international level, that has massive impacts for harm reduction.
Do you speak to organizations who are affected by these budget cuts? How do they feel? Can you tell us any stories about how it affects their lives?
Yeah, what we have done, because when the US funding cuts happened, we had to think about what would be most useful. As HRI, what could we do? And one of the things that we decided to do was to work with the partners that we had working at national level to put together on paper all of the evidence for why harm reduction was needed, what the programs were in the country, and what the impacts of the cuts have been. So we've done that with partners in several countries, and we're circulating these documents to people that are having the national dialogues. So UN agencies, the Global Fund, people working at country level, so that when the discussions happen about how do we mitigate the impacts, they have the information about harm reduction there, and they can see what the impacts are on the harm reduction program. So, for example, we worked with the Ugandan Harm Reduction Network to kind of hear from them what the impacts have been. OAT stopped overnight in Uganda, and people didn't know where to go to get what they needed, and there were many desperate people, and unfortunately it's one of the places where we've heard about overdoses being reported. In Uganda, I think they're working really, really hard. There's really strong advocates there from the key population, broadly, civil society networks there that are getting together to talk about how to mitigate the impacts. And the government has also said positive things. So I think it's potentially a place where we could see some support that would help those programs continue to run. But we haven't seen it quite yet. It's not quite happened quite yet.
I don't want to silver line this is a terrible crisis, but do you think there can be some opportunities in this crisis to push governments, national governments, to contribute more to the funding of harm reduction?
I do. I think that's a really important thing for all of us as harm reduction advocates to be pushing. This is a moment where governments can take control of their situation and decide where to put the funding. But I think that the danger for harm reduction is that the US aid funding went across so many different things, and so governments are having to make decisions about so many different budget constraints and which gaps to fill. And we need to be very strong in the message that harm reduction has to be part of that piece, and it's a wise investment for governments. It's cost effective, there's economic value, there's public health value, there's human rights value. I think it's about making that argument in a way that governments are going to really hear it.
So if you look around the world, there is something which I can call a chronic reluctance of governments to fund harm reduction, and in general public health. It's so easy to get funding for security. Why do you think that there is this disproportionality?
I think that people who use drugs are stigmatized, and I think that it's easy for governments to say that we will go hard against drug use, and we will fund punitive drug policies because that's the status quo. I think it's something that I think will bring votes and popularity in government, and there's a lot of scapegoating of people who use drugs within that picture, and it's our job to shed light on why that's wrong, and also to say that, you know, governments have been spending money in the wrong way, and make that economic argument and say that you will get more out of it if you take a little piece of that money and divest it away from punitive approaches and invest in your communities and your health systems and justice, and harm reduction is a big part of that.
Can you highlight any positive examples where divestment from punitive drug policies and investment into health policies happened?
Yeah, it's important that we can give examples of this campaign to kind of give people practical illustrations of where this has happened and the positive examples. So before the conference, we gathered some examples from Latin America. So I can tell you about Uruguay, for example, where they had real kind of overcapacity in the prisons, and they were arresting people for use of cannabis on a regular basis. And in 2012, I think, they changed the law, and they were the first country in the world to legalize the commercialization of marijuana. And this meant that they weren't spending money on arresting people and imprisoning people for small amounts of personal possession of drugs. And so they then put money into a harm reduction approach, which you know, has yielded great results in the country. Another example would be in Chile, where they had big numbers of people going to prison. They were among the homeless population, so they were arresting people for drug use, and they were also homeless. And they realised that this was not a positive way to kind of confront the issue of homelessness and drug use, and they ended up taking a housing first approach, where they, you know, gave people housing, and they then would link people up with treatment and harm reduction services. And in the last couple of years, they've increased the budget exponentially on the Housing First project, and they've seen really, really good results.